Yeah, here I think we get again to that question that we made before we start our work. Are we decreasing HAE mortality? And what you can conclude that patients around the world have access to different diagnoses and treatment resources.
Hello and welcome to this next episode of All Things Angioedema, your A-Care podcast, learning with Dr. Thomas Woodgereit about angioedema. My name is Thomas, I'm the host of this podcast, and I welcome you to today's episode. And today we are actually dealing with a very sad topic, namely death caused by angioedema. What we have learned so far from the previous All Things Angioedema episodes is that some types of angioedema, like HAE, can be fatal in rare cases, while other forms do not. And HAE hereditary angioedema is one of these forms that definitely can lead to life-threatening situations and even cause death. And in today's episode, we want to find out more about how high the reported rate actually of death due to HAE attacks is. So we will talk about mortality in HAE and how it maybe differs around the world and maybe in some centers, and why actually this is the case. And for this, I invited, I hope I spell this name correctly, Fernanda from Brazil. Hello, Fernanda.
Hi, Thomas. Hi, everyone. Thank you very much for this invitation. It's a pleasure to be here. I'm very honored. You did spell it right.
Cool. So, Fernanda, maybe can I ask you maybe to introduce yourself so that everyone then knows to which persons they are listening to? So what do you do, what you're interested in, and yeah, what your profession actually is?
Okay, thank you. I'm an allergist and immunologist, and I'm a professor at the Federal University here in Brazil. It's called Federal University of Minas Gerais. And I have done my master's degree, my PhD degree in this area, and I evaluated patients with hereditary angioedema. And I'm one of the responsible physicians for an outpatient clinic here for inborn errors of immunity in our state in Brazil. Brazil is a very huge country, so only our state's like the size of Spain. So we are a very large territory country. And in our outpatient clinic, we have more than 200 patients with hereditary angioedema.
Wow, that's quite a lot. Wow.
Yes.
So, as you know, the topic today, and that's why I invited you, is mortality due to HAE. As I said, actually a very sad topic, but let's make this as interesting and let's get so many learnings out of this episode as we can. Maybe as the first question, how actually did you come to this issue, to deal with this topic scientifically? Tell us more about this.
Yes, Thomas, that's a really sad topic, but it's necessary to talk about it, right? So as I said before, we have a lot of patients with hereditary angioedema, and it's not rare for them to come to us saying that they lost someone in their family because of the disease. So this experience in treating patients with HAE led us to want to know more about the disease and want to know more about the deaths also in these patients. And I have to give some credit also to Dr. Annette Grumat. She was an inspiration also for this study, especially in studying mortality. We met once in a workshop, and we were discussing about the severity of these patients, of the disease, and we talked about the lack of knowledge about how many patients did actually died because of the disease. And one of the major questions was if we were really decreasing HAE mortality in the last decades. So that was the inspiration about this plan to do this work.
So could you maybe explain or just elaborate a bit on it, what actually the cause of death in HAE in most of the cases is due to the disease? For the people who are not that familiar yet in this episode with HAE, with hereditary angioedema?
So before you have to learn a little bit more about hereditary angioedema, you need to know that the disease evolves with recurrent edema in many parts of the body, like hand, face, tongue, abdominal pain, but it also may affect the upper airway. And so when it happens, it may develop laryngeal edema, which is a life-threatening situation because the patient can evolve with asphyxia and actually die because of the laryngeal. And there's another important fact that this laryngeal edema is not developed very fast as in anaphylaxis. So the patients usually have plenty of time to do their own medication, rescue medication, or to go to a hospital if they don't have the rescue medication with them. So it's not that fast as in anaphylaxis.
So, as you know, I invited you for that reason to talk about, because I know that you did some interesting research work on this topic, and I listened to one of your talks you gave maybe 1 or 2 years ago on on a conference I joined. And also, when you look into the literature, you may find 2 articles from you and your team dealing with this topic, and both have been actually published in 2022. So yeah, just two or 3 months. The first one in February, and then in July 2022. So congrats on these great achievements in your scientific career. So when you look on these works, the first one was a review article. And could you maybe explain in easy words, in layman's words, what you actually investigated in this work, what this work was? I think it was a systematic review article on mortality and HAE, and what maybe the key learnings, conclusions you did and achieved with this article.
Thank you, Thomas. It was really a good work to do. And this first one that we did a systematic review, we want to know more what was happening around the world. And what we already know about HA deaths is that it's described since the first description of the disease in 1880. So we know that HA is a cause of death. But what we urge to know what was our reality of it. So we did an extensive research of the literature, and that was discussing this topic. We found 23 articles, papers that fulfilled the criteria that for the analysis. And these papers described more than 3,000 patients with HAE, and 400 of them, a little bit more than 400, died from asphyxia. And we analyzed the orange of the articles. As we predicted, most of them were or from US or from Europe, which showed the necessity to know more about the reality in middle-income countries. And most of them showed that undiagnosed patients are in greater risk of asphyxiation when compared to patients with previously diagnosed. 18 of these studies evaluated death rates from laryngeal edema in these populations, and we found an average of 1 death for each 20 patients, which is really high.
Wow. That's high. And you said this article focused, or from this literature review, you found
Yes.
more articles from European
US.
and US, from the US, but not from the countries, from the developing countries,
Yes.
right? Is that true?
Yes, that's it.
Okay. And this was maybe also then the reason why you focused in another article in the death rates of HAE in your center, in your region where you are practicing, right, in Brazil. Was this
Yes.
the reason?
Yeah, that's it. Then we needed to know more about what we are passing through.
And this was, I think, the lecture I was listening to a couple of years ago, where you summarized your findings from your reference center in
Yes.
Brazil for angioedema. And can you maybe tell us some more about it, what you found in
Sure.
your research from your center?
I'm explaining a little bit how we did this work because it's kind of different. We interviewed our patients, what was around 200 patients, and we draw the family trees of these patients and as a hereditary disease. And we are trying to understand from these family trees who in this family had or not hereditary angioedema. And then from these family trees, we try to understand which deaths had already occurred. And for that, we used a very interesting instrument called verbal autopsy. A verbal autopsy is an instrument that can allow us to investigate deaths that happened from undefined causes. So it was a very interesting instrument to use. As I know, as we talked before, it's a delicate subject. So I did all the interviews with the families, and all of them was done by me. And I could saw the suffering of the families who lost patients from the disease. And this work, this paper we published, that we found 52% of the patients who had died with HAE had died because of asphyxia. So it's a huge number because none of most common causes of deaths around the world is as big as that. So it's one cause of death causing 52% of the deaths. And of course, many of these deaths occurred in patients who did not had previously diagnosis, and none of the patients who died had adequate treatment. So there are two important points here: to do diagnosis and to have access to treatment. And another data that's very important, it's that the patients who died from asphyxia died 20 years earlier than patients who died from other causes. So what we saw is that the HAE shortened the life of the patients in more than 20 years. And many of the deaths occurred many years ago, but we saw that deaths still occurs in Brazil. So that's 10 of them was very soon, as in like 2010 to 2020, 10 of these deaths. So they are still occurring. So it's the major data that we saw in this work.
25%, really high number. Maybe the other way around. What about the other 48% of cases? Was this also death related to HAE, or you said other causes? What did you find out there? Any relation to HAE?
That's a very interesting question. The other causes were generally causes of death, like heart disease, respiratory disease, and most of them was not directly linked to HAE. But we saw very interesting data that the confusion between what was the real cause of death, that was asphyxia, and causes of death in their death certificate for these patients. We saw that physicians really confusing, like putting renal causes, renal disease for HAE patients because they like get edema. And 18% of the patients' death certificated was undefined causes. They didn't have a defined cause in their death certificate. So the physicians did not know what was the cause of death in these patients.
So when you look on this data and on these publications, what conclusions could you draw for yourself, for your clinical practice? What do you take from these results?
Yeah, here I think we get again to that question that we made before we start our work. Are we decreasing HAE mortality? And what you can conclude that patients around the world have access to different diagnoses and treatment resources. So this careful look to patients with limited resources shows that a high mortality continues to be a reality. And major in middle-income countries in developing. Asphyxia due to angioedema is the most common cause of death in this patient, and even compared with the sum of all other causes together, this larger number of undiagnosed patients make the situations even more severe and is responsible for most of the deaths. What it gets really in focus is that patients need to have access to confirmatory tests, appropriate treatment. It must be defended by health authorities. And achieving these results must be a goal for healthcare professionals, for patients association. And as here in Brazil, we need to the public policies directed to do the correct diagnosis and access to treatment that are indispensable for changing this scenario.
And Fernanda, we are now, I think, 3 years, at least 3 years further steps.
Yes.
So the publication is from 2022, and the data you have are probably a bit older even than 2022. So now we have 2025. So when you now compare the situation from that time you published the article and looked on the data and have now 2022. Did anything change from your perspective as a reference center for angioedema? Did anything change so far? Or in other words, maybe to say, if there isn't a change, what should be done more?
We have new medications available, but they are not actually available for the patients. They are being developed and it's very good, but they are not available for the patients, most because of the higher cost. So we see a difference, not that large difference that can make really change in patients' reality. So we want to do this evaluation that we did here in our center worldwide. We want to do that. So we need more physicians to do that, of course, because we can do that alone. It would be a worldwide work, but I think it is necessary to show the reality all around the world as possible, as we can do, possibly in A-care centers, using the A-care centers to do so, and to still evaluate this if these deaths are occurring yet.
Yeah, very interesting. And so did you actually so you are really shouting out that the global approach is needed, but did you actually continue on this research on death and mortality in HAE or what are other maybe research aspects you are now performing in HAE? Maybe can you tell us at the end of this podcast episode what your other interests in HAE are and unmet needs maybe you see from your side?
We are doing a registration in Brazil now. My center is not the first center, but we are doing the Brazil registration, which is already a huge work because there are a lot of patients. And after that, we want to do this death evaluation in the Brazil and then spread it to other care centers. That's
Great.
what we are focused now.
So you want to run a huge project together with other A-care centers to gather more data from around the globe, as I
Yeah,
heard.
that's what we want to do.
That's great.
Yes.
Yeah, that's why we have this great network of A-care centers to do this. Great, fantastic. Yeah, Fernanda, I think it was a pleasure to meet
Yeah.
you in this podcast to talk more about this, yeah, unfortunately very sad topic, but I learned very much. I learned a lot that there's really an unmet need in this area, especially in the developing countries, to get this situation, to improve this situation as fast as we can with providing easier access, as you said, to diagnostic tools, but also access to proper treatment to treat this disease with the medication the patients need and which are actually licensed and effective in H. Thank you very much for having you had in this episode. It was a pleasure to talk to you and to have a short chat to Brazil.
Yeah.
And I heard that the carnival now is starting,
Yeah.
right? And you're preparing for this.
Yeah, I'm traveling tomorrow, so to a very nice place here. Please, everyone is welcome to Brazil. We have a beautiful country despite all of these problems. So please come to meet us. I'm going to Maceió. It's a beautiful beach here. So please just put there Maceió. It's beautiful. Thank you,
Okay,
Thomas, very much for the invitation. If you want to talk to me again, it will be a pleasure. And hope to meet you soon.
I think we will talk to each other soon again and maybe also in the podcast episode. Thank you very much. Thank you very much to the people listening to this podcast. If you have any questions to me or to Fernanda, do not hesitate to reach out to us. Thank you very much. Have a great day.